Does medical math make you want to throw your textbook across the room when you're doing the problems? If that's the case, you are not alone. But I'm here to help you simplify the process so that you're able to do this math confidently, quickly, and you do an algebra without even realizing that you're doing it. Now, I can definitely tell you my personal story. Whenever I was in my algebra class and I was trying to understand algebra, I got so frustrated that I picked up my hardback textbook, threw it across the room, and I almost hit my wife in the head on one occasion. Now, at that point in time, she vowed that she would never, ever, ever try to teach me math ever again. And who can blame her, right? All right, so let's start diving in on how to do your medical math, your nursing math, as easy as can be. After all, if you do not do your calculations right, you could end up killing a patient. Okay, so we have our first question set up. Doctor orders to give Tylenol 1,000 milligrams PO every 6 hours as needed for pain and fever greater than 101 degrees Fahrenheit. What we have available is going to be Tylenol 500 milligram tablets. The question is actually asking you, how many tablets do you give per dose? All right, so we're going to need a formula. Let's set the formula up. You may have seen in school where you have D over H times V. The formula I'm going to show you is going to be kind of the same thing with just a little bit of modification. We're going to have our doctor's order over available is also going to be on hand. That's what that equals. So we have doctor's order over on hand times V. V equals vehicle. Don't panic. I'm going to make this really simple. Right now, we're going to take the information that's here and plug it in down here so we can figure out how to do this problem and figure out how many tablets to give our patient. All right. So what's the doctor's order? Doctor's order is 1,000 milligrams. What do we have available to us, or what do we have on hand? Well, 500 milligrams, right? What's our vehicle? In this case, our vehicle is going to be tablets. So it's going to be times tabs, right? Always make sure you put in whatever it is after, if it's milligrams, grams, whichever, micrograms. All right, so right now, just hear me out. Milligram and milligram, these are equal. We always check to make sure that they are the same. If not, we have to do conversion. I could teach you that on a different video if you want. Please give me a comment down below if that's what you want to see. All right, so the first thing we're going to do is we're dividing. Milligrams will cross out because basically this equals 1 milligram equals 1 milligram. 1 divided by 1 is 1. Okay, now we're going to take and we're going to divide 1,000 over 500. If you divide that, what do you get? That's going to equal 2. Milligrams is no longer in the equation because they are canceled out. So then that leaves us to bring this down, which is going to be our times our vehicle. In this case, is going to be tablets. 2 times tabs equals 2 tabs. We're going to give our patient 2 tabs. I know this was a very easy problem. You could have done it in your head, but you need to follow these steps. On the next video, I'm going to show you how we're going to take and include milliliters into this so that if we're drawing up in a syringe, you're going to know how to do the math for that to give your patient a safe dose in through the vein. All right. Again, if you like this video, please like, share, and comment. If you'd like to learn more about how to do math and want some personal one-on-one attention, I am going to leave a calendar. It's going to be in the description. Please feel free to click on that calendar. They'll send me a message, and we can meet and discuss what needs you have, whether you're a nursing student or if you need assistance with how to pass the NCLEX. Till the next video, happy studying.